We have a quorum, so clerk, please call the roll.
Senator Boswell.
Here.
Senator Douglas.
Present.
Senator Thomas.
Here.
Representative Chester Burton. Here. Representative McCool. Representative Pollock.
Here.
Senator Meredith.
Present.
Chairman Hart.
Here. First item on the agenda is the consideration of the minutes of the February 13th, 2024 meeting of the committee. Motion by Senator, sorry about that, Senator Meredith, and a second by Senator Douglas. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Yes.
Chairman Hart.
Yes, motion carries. Total number of items on the agenda today are 459 in the amount of 319,700,000. Yeah, no, that's right. $319,790,197.18. All vendors are registered with the Secretary of State's office. Next
Point of order here, Mr. Chair. I don't believe we called the roll.
No, we did.
Did we? Oh. Well, Senator Douglas wasn't paying attention.
No, we didn't.
Would you like us to do it again to refresh your memory?
I would.
Getting caught in crossfire.
No, we did.
Did you?
And it's duly noted that Senator Douglas is here.
Okay.
Okay. The next order of business is consideration of the agenda, including the personal service contract list, personal service contract amendment list, memorandum of agreement list, memorandum of agreement amendment list, and the Kentucky Entertainment Incentive Program agreement list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection?
So moved.
Motion by
Second.
Senator Meredith, seconded by Senator Boswell. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. The first item on the pool list are with the Cabinet for Health and Family Services, Department for Aging and Independent Living, and our items number 14 and 15 on the routine PSC green list. If representatives are here, please come forward. Please identify yourself for the record.
Good afternoon. I am Marnie Mountjoy, Director of the Division of Quality Living within the Department for Aging and Independent Living.
Hi, I'm Amy Metzger. I'm the Division Director for the Division of Finance and Administration within
All right.
the Department of Aging and Independent Living.
Thank you all for being here. If you could, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
Thank you so much. And I think Senator Douglas has some questions.
I do. Thank you, Mr. Chair. I do. Thank you, Mr. Chair. The questions I had in reviewing the contracts, not practical or feasible to bid the documents. Are there no firms here in the Commonwealth that would qualify?
Not for the level of care that these two individuals have related to their traumatic brain injury. We have one at the placement in Texas and one at the placement in Illinois, and their level of care is the highest level of care, and there's not anything here in Kentucky that can meet their needs.
Could you explain to me? May I ask one more question,
go
Mr.
right
Chair?
ahead.
What levels aren't we talking about in terms of care for which we can't supply those here in the Commonwealth?
A locked facility with a residential component, and then one of the individuals has committed criminal activity and is a pretty high level of need, needs the one-on-one attention, and we just don't have that ability to meet those needs.
May I ask one more?
Just go right ahead.
Did I hear you mention two individuals?
It's only two folks. There's one in Texas and one in Illinois.
Then I'm having a little issue with. We're talking $400,000 a year, or actually we're talking $800,000 a year, something like that.
We don't spend that full amount. That's just the amount that we put on the contract in case something happens, because it's, in the event of emergency, it's pretty tough to get a contract through to add additional funds. So we just put extra funds on there. We've never spent that full amount.
Do we have, I'm sorry, Mr. Chair.
Go right ahead.
Do we have any idea of what we, on average, have
Yes, sir.
spent?
Yes, sir.
Sure. So, like, for example, this year so far, we've only spent 12% of the funds of the 800,000.
Okay.
So for the last 3 or 4 years, it's been right at 25%.
Thank you, Mr. Chair.
All right. Do we have any other questions? I have a motion to approve by Senator Meredith. Do I have a second? Second by Representative Pollock. I'm sorry. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Thomas.
Thomas? Aye.
Yeah. Senator Douglas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. Thank you, ladies, so much.
Thank you.
The next item on the pull list are with the Department for Medicaid Services and are items number 17 and 18 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record.
Leslie Hoffman, Deputy Commissioner. Angie Parker, Director of Quality and Population Health.
Amy Richardson, Director of Fiscal Management.
All right, thank you all so much. If you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Thank you so much. And on item number 17, Co-Chair Meredith has a question.
Thank you, Mr. Chair, and thank you all for being here this afternoon. I'm sure you'd rather be with us than outside enjoying this beautiful weather. We had as well. Mr. Chair, if I could, I'd like to talk about 17 and 18 together.
That'd be fine. Go
Because
right
it's
ahead.
kind of the central theme here. You look at 17, and we're spending $4.6 million for external quality review organization, which I assume is required by CMS. But then you go over to the next one for the establish the reimbursement rates, and we're spending $26 million. And I bring this to your attention, and this is where I just preach a little bit, and this has got nothing to do with you folks, it's the system itself. But, you know, we're spending, as a nation, 30 cents of every dollar of healthcare on the administration of healthcare. And that's astronomical, and here's an example. I just wonder how many people we could provide services to if we weren't spending $30 million on these particular functions. And at some point in time, we're going to have to get control of this, or quite literally, our economy is going to collapse because we can't continue on this trajectory. But specific to these two contracts, first, 17, I have no question. I understand that we have to do it. It's part of the Medicaid program. 18, it's a rather elaborate review. Excuse me, I'm doing this backwards. 17 says this is for external quality review, and you're covering a lot of different points here, which is certainly valuable to us. But how is this information reported, or is it reported to our legislature? How do we receive that?
It is currently not reported to the legislator. It is reported via our website in our quality branch on the Department for Medicaid Services website.
So any of us can access that?
Yes, sir.
Okay. Can you maybe email me what that
Absolutely.
site is? Because I would like to know, because we've had a lot of discussions over the past few years about the quality of services that our MCOs are rendering. I'm particularly interested about access to timely quality care. They've testified previously they're doing a great job, and over 90% compliance with that, and we know that may be different, but I appreciate that. But
Sure.
other than that, Mr. Chair, I have no questions, further questions. I'd make a motion to approve both contracts.
Okay, I've got one real quick question, and it's mainly related to item 18. In a year's time, how many patients do you anticipate that you all will evaluate?
So this contract doesn't evaluate patients. This contract establishes reimbursement rates for our providers,
Okay,
for fee-for-service providers.
all right. So it's really not related to patient evaluation at all. It's more of an administrative. Okay,
Correct.
all right. Is there any other questions? You got a question? You sure? Okay. Does anybody else have any questions? If not, I have a I have a motion by Senator Meredith to approve the contract. Do I have a second? I got a second by Senator Douglas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion passes. Thank you, ladies, so much. The next item on the pool, the next items on the pool list are with the Department of Criminal Justice Training, and our items numbers 23 and 24 on the routine PSC green list. If the representatives are here, please come forward. Identify yourself for the record.
Good afternoon. I'm Nathan Goins with the Justice and Public Safety Cabinet Office of Legal Services.
Good afternoon. I'm Mark Wilson, Section Supervisor of the Resiliency Section at the Department of Criminal Justice Training.
Good afternoon. I'm Gabriel Gillingham. I'm an instructor with the Department of Criminal Justice Training, and I'm the program coordinator for the Kentucky Post-Critical Incident Seminar.
All right, thank you, gentlemen. If you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God? Thank you all so much. I have a couple questions. So you're all providing mental health counseling services at seminars, is that correct?
Yes, sir, that is correct.
About how many seminars do y'all think y'all do a year?
We currently run 8 a year, sir.
8 a year?
Yes, sir.
When you perform your seminars, so I noticed we found some counselors in the Burlington, Kentucky area. Is your 8 seminars, are they regionalized or are they throughout the state?
So typically where we hold ours at are in Lexington, and that's just based off of the location of being able to have a venue.
Okay. And I'm assuming that your seminars, are they more for like continuing ed type hours for other personnel, or is it just general knowledge information for the public? Or
No, it is part of yearly requirements for certification through Kentucky Law Enforcement Council. They do receive 24 hours of in-service credit for attending.
Okay. All right. That's all the questions I had. Is there anybody that has any other questions or comments? Motion approved. All right. I have a motion to approve by Senator Meredith, seconded by Representative Pollock. All those in favor vote aye. All those opposed vote nay. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Thomas.
Aye.
Senator Douglas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. Thank you, gentlemen, for coming. We appreciate it. The next items on the pool list are with the Department of Highways, and our numbers 37 and 38 on the routine PSC green list. If the representatives are here, please come forward and identify yourself for the record. They are virtual. Okay. Are y'all on there for us?
Yes. Good
All right.
afternoon. Jason Salala, Deputy State Highway Engineer, KYTC.
All right. If you would, please raise your right hand. Do you solemnly
I've got
swear?
one more person with me to introduce, and then.
Oh, okay. I'm sorry.
Hi, I'm Eric Pelfrey, Director of Professional Services.
Thank you so much. Sorry for getting ahead of myself. Do you all solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
All right. Thank you, gentlemen. Senator Douglas has a question.
Thank you, Mr. Chairman. For you two gentlemen, could you educate me on alternative delivery services? Perhaps everyone else knows what that means, but I guess I just don't.
Sure. So the Transportation Cabinet, the majority of the construction contracts that we put out are what it would be known as design, bid, build. And so you design a project and you go through all of the project development process. You let it to construction, and then that construction contract is awarded to a contractor to go out there and build. And those items are are separate. That would be, kind of what the typical process looks like. And alternative delivery are methods of doing early contractor engagement in a lot of cases, different types of delivery methods such as design build, progressive design build, or construction manager general contractor. And so these are considered alternative delivery because in these cases you have both designer personnel and construction personnel collaborating on the front end of the project, throughout that development process, and also during the delivery process, during that construction process as well. So it's a little different than how we would normally do contracting, and so that's why they're called alternative delivery, sir.
Yeah, I ask one
Yes,
question,
go right
Mr.
ahead.
Chair. With the alternative delivery services, could you help me with whether design, bid, build, or versus the alternative delivery services, which one is faster and which one is the more cost effective?
I think that in order to answer that question, I have to just give a nuanced response to say, all projects are different, and so
We're gonna look at we're gonna look similar projects.
Sure. Well, and again, I think that the transportation cabinet, seeks to deliver in the most efficient manner possible for the type of project that we have. And so the types of things that lend themselves well to alternative delivery are things maybe where you have a compressed schedule, or where there's significant opportunity for innovation on a project, where that collaboration between designer and construction and construction contractor, provides an innovation benefit. And so when we think about the way that we would typically do the process, many of the projects that we do, once we've come up with a design concept and go through the project development process, that's a process that's well established and works quite well for delivering projects that don't necessarily have particular complexities, or they don't have time pressure or particular innovation requirements. And so in general, the reason why somebody might consider alternative delivery might be to do either one of those things in a different way, either accelerate a timeline or seek to more efficiently deliver a project. And so when you think about it, the types of projects that might lend themselves well are ones that have solutions that you could solve the same problem a variety of different ways and get a similar outcome, but by working together collaboratively between design and construction, you might be able again to shorten that timeline or to significantly reduce costs.
Thank you, Mr. Chair.
All right, Senator Boswell.
Thank you, Mr. Chairman. Yes, I've been involved in some projects in the past where a design build was involved, and those were very successful as far as saving money. And so I would just make this comment. I think we need to be looking at that more, but I think we need to resolve, is our state government actually saving money? If they're not, then maybe we need to be working a little harder to make sure they do. Thank you.
Is there any other questions?
Motion to approve.
I have a motion by Senator Meredith to approve. Do I have a second? Second by Senator Boswell. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion carries. Thank you, gentlemen, for being with us.
Thank you.
The next item on the pool list is with the Department of Insurance and is item number 39 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record. Are they virtual?
I'm here, Mr. Chairman, virtually.
Okay.
And I'm Sharon Clark, the Commissioner at the Department of Insurance.
All right, and do you have anybody with you?
No, sir.
All right, if you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I will.
All right, thank you so much. And I have a couple questions. Are while I was looking over this, are private insurers and agents billed when your office does an audit or conducts an audit?
Yes, sir. The total funds for all of my examiners are paid by the insurance company that is being audited or examined.
All right. And does how are the audit? Do you choose them randomly, or what triggers an audit?
There's two types, Mr. Chairman, two types of examination. One is what we call a comprehensive exam, where we go in and look at all aspects of their business practices. But also we have targeted examinations. And that might be because we've received several complaints on how they're paying claims or how they're marketing or how they're performing their underwriting. So it just depends on the situation, sir, on, what transpires.
All right. Thank you so much. And how are your rates established?
Sir, we have a rate that is very similar. In fact, we're on the low end. Every Department of Insurance performs market conduct exams. And our rate, I would say, is on the lower end of that. We establish it. A lot of times these examiners and analysts have to go on site to where the insurance company is located. So the rates are set if they're working locally in their homes or at the office, it's one rate. If they ended up having to go to a high-cost area, let's say that the insurance company was located in New York, that would be a high-cost area, so there is a higher cost pay. And the examiners absorb all their living expenses also out of this, so that higher rate helps to subsidize living expenses when they're away from their office or home.
Okay. Thank you so much.
Now you've got me thinking about it.
Senator Meredith.
Thank you. I'm a little confused by the effective dates. It says February.
Yes, sir. This particular contract, we had a retirement by one of our examiners, and we had another examiner that came and was only with us 6 weeks before private business stole him away. But so normally they're on a 2-year cycle, from July 1st to June 30th. In this case, this examiner started on February 4th of this year, and her contract ends on June 30th. Then we have the option to renew that. So it is confusing, but normally they're on a regular 2-year cycle, Senator.
Well, what's even more confusing, if this is a 4-month contract at $187,000, that's over $500,000 a year for this individual?
Yes, sir. I understand that. And that $187,000 would be for a 1-year period. Why that is on the contract, I don't know how finance works this, but it is only, that would be for 1 year. And I will make the comment that rate is calculated if every examiner had the highest rate, they were in a high cost area, and they worked a full year. Most of our examiners are, for the last 4 years, they have billed out 50 to 60% of their contracts, sir.
Appreciate that explanation. Again, we're given a very limited amount of information when we see these contracts, and they certainly caught my attention, but thank you. That's all I have, Mr.
Yes,
Chair.
sir.
All right. Senator Boswell.
Well, since this questioning came up, I just have one little question. So you mentioned, like, for example, when you had to go to New York, we could use the additional tourism in the state of Kentucky. Maybe we ought to consider, is it required by statute that we go to their office, or is it not possible that they could bring their people, their main people to here to be audited at your offices?
Well, sir, we're now able to do a lot. That high rate area is rarely used anymore because now the technology is such that we can do this virtually. But literally, when they did do that, Senator Boswell, they would go on site and actually pull files and what have you randomly. So, but again, we're able to do that now virtually. So that also lowers the cost of these contracts.
All right. Any other comments or questions? Go ahead, Senator Douglas.
Thank you, Mr. Chair. So with that being the case, would we expect to see a change in the contract the next time around in terms of the amount?
Well, I think as some of the previous speakers said the same thing today. We have to plan for the worst case scenario, Senator Douglas, where
But we have a history. We have a history of what is normally billed, and we continue to plan for the worst case scenario, knowing that history isn't the worst case scenario.
Senator Douglas, I will certainly take that under advisement and go back and see and do further calculations, sir.
Thank you. Thank you very much. Thank you, Mr. Chair.
All right. Anybody else? If not, do I have a motion to approve?
So moved.
I have a motion by Senator Meredith, a second by Senator Boswell. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion passes. Thank you, ma'am, for being with us.
Thank you, Mr. Chairman, members.
The next item on the pool list is with the Kentucky Board of Emergency Medical Services and is item number 49 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record.
Eddie Sloan, Kentucky Board of VMS.
Mr. Sloan, would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you so much for being with us, and I think Co-Chair Meredith has a question.
I do, and appreciate you being here this afternoon. Is this your first time appear before our committee?
Before this committee, yes, sir.
We have an initiation period that you have. No, not really, but there's some information missing, and I'm going to tell you what I think is happening here. Then you can correct me where I'm right or wrong. Because this contract says September 22nd through 24, and previously you were under the community college system.
Yes, sir.
And kind of spun off, so to speak.
Yes, sir.
So this is a continuation of that contract. Is that?
That is correct.
And since you were under their guidelines where they didn't have to come before our committee, thus the retroactive date.
That is correct.
Okay. And it also says it's not practical or feasible to bid. And again, I'm assuming because it's a continuation contract already in place.
That is correct.
So I'm curious what happens in June 2024. Have you developed an RFP? Are you actively looking for?
No, sir. We had been working 15 months to try to get this one approved, but we will, as the contract expires, we will certainly open it up for the process and seek for qualified physicians to serve in that role.
Well, that's what also confuses me, because in the letter here that we get, and this is all we receive, again, it says the contract expires 2024, but in the explanation it says the current contract has 2 more years remaining. So is that
part of the process that had taken place here? Is that we've been into this since September of 2022, in between the state process and the University of Cincinnati, which is a pretty big wheel. Also, none of the material items, none of the deliverables changed. They all remained the same. But for whatever reason, we've been to this point getting the University of Cincinnati and the Commonwealth of Kentucky on an agreeable page for the beyond the deliverables, the other points to get the contract approved. We got it approved and couldn't get it signed before the expiration of the original contract, and we wanted to take the 1-year extension, if that makes sense. But it expired before we were able to take the extension.
maybe sort of, but how many years do we have left on the contract?
Well, it would be 1 year from the expiration date of the contract. So it expired on the 28th, so February of 2025.
So it's not 2 years. That's what I'm trying to get to. So we're committed to them through February
that is
2025. And preceding that, you folks will develop an RFP to hopefully, I won't say hopefully engage somebody else, but just transparency of the process to see that we're getting the best service.
Absolutely.
Okay, I appreciate that. That's all I have, Mr. Chair.
Any other questions?
Motion to approve.
I have a motion by Senator Meredith to approve. Do I have a second? Second by Senator Boswell. If there's no other questions, all those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion passes. Thank you so much for being here. The next item on the pool list is with Morehead State University, and is item number 55 on the routine PSC green list. If representatives are here, please come forward and identify yourself for the record. And I think you're all virtually.
Yes.
And,
I'm Misty Litton. I'm in charge of disability services at Morehead State University.
all right, and are you by yourself, ma'am?
Yes.
All right. If you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes.
Thank you so much. And I believe Senator Meredith has a question. Or
Yeah, I'll start this discussion asking the same question. Is this your first time to testify before our committee?
Yes.
So you're the sacrificial lamb? Is that it?
Yes.
Do you know why this contract was pulled?
Yes.
Yeah. So
Absolutely.
You're the sacrificial lamb.
Yes.
Got it. Yeah, a retroactive request for approval, which I have a history of detesting. In your letter here, you acknowledge that there was a faux pas, that this did not come to our committee on a timely basis. And then you said steps were immediately taken to pursue renewal of the contract. I'm more interested in what steps were taken to ensure that we don't have any more retroactive approval of contracts from Morehead State.
Yes. And that's absolutely, I mean, that was my question too. That was the first thing that I did, is I worked with our procurement department and I made sure that it's on our calendar moving forward. We had a particularly rocky summer and I'm new in my position. And so this was a ball that I dropped. It was something that I was not watching closely enough because I don't have a student currently, and I haven't had a student in my time here who uses these services. And in June in particular, I had health issues and my father-in-law passed away. And immediately upon returning to work, MSU had a cyber attack that took down all of our systems. And so there just wasn't, it just didn't come on my radar for just happenstance reasons that would never in a million years happen again, until we had the sign language interpreters at graduation and we realized our flub up, and we communicated with each other and made a plan with each other for how to never let this happen again, and then we submitted it all for approval after the fact.
You're not making this up, are you? Well, just one caution. When you say it'll never happen again in a million years,
Oh,
I don't know you want to make that commitment or not, but I'll take you at your word on that. But again, not to pick on you and not to pick on Morehead, but to me, this speaks to the financial integrity of any organization that we get this information on a timely basis, and in turn, we're like the good housekeeping seal of approval. If we say it's good, it's good. So I wish you the best going forward. Appreciate your explanation, and good luck to you.
thank you.
any other questions?
Motion approved. Oh, sorry.
Senator Thomas.
Yes, ma'am. Tell me your name again, please.
Misty Litton.
Miss Linton. Yeah, I'm Senator Thomas. You know, Miss Linton, I had said that the next time I was going to deal with a retroactive contract, I was going to vote against it. But I am a human being, and you know I understand how life works, and I've had personal experiences with people having sick and having health concerns, and I understand the loss of a parent as well. I've had that happen in my lifetime. So I think you are entitled to a pass here, and I'm not going to vote against this issue with retroactive contracts. But I do want to say this for the future. I've only been on this committee a short time, about maybe 6 or 7 months, maybe about 6 or 7 months. And this is the second time in that short period, in less than a year, that Morehead State, not you, but Morehead State has come before us with a retroactive contract. They did that back sometime around October, November, and now here it is in March. And while I'm going to vote for the contract, I would ask you, now that you're healthy and back at work, that next week Morehead really take a look at its policies and practices regarding personal service contracts, and come up with something that's written and followed, so that we don't see this again in another 5 or 6 months. I would ask that you begin that process.
I will definitely convey your message. I'll talk to our procurement department tomorrow and we'll discuss that.
All right, I do believe I have a motion by Senator Meredith for approval. Do I have a second? Second by Senator Douglas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion passes. Thank you so much for being with us tonight. Let's see. The next item on the pulled list is with the Department of Education and is number 92 on the routine MOA pink list. If representatives are here, please come forward and identify yourself for the record.
Good afternoon. My name is Karen Worth. I'm in the Division of Budgets and Financial Management at the Department of Education.
Good afternoon. I'm Erin Chavez. I'm an academic program consultant with the Office of Teaching and Learning at KDE.
All right, thank you all so much. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you all so much, and I think Senator Douglas has a question.
Thank you, Mr. Chair, and welcome, ladies. We really enjoy your company this time of the day. In looking at the amount of the agreement, I took a review and looked at the other contracts in this particular space, and perhaps you could help me and the other members of this committee to understand. I've seen some as low as $40,000, but I'm trying to get a grasp on this amount.
Yes, Graves County actually had 8 schools that applied and were awarded through the RFA process, and they were each $40,000. So they have 8 schools in the district receiving $40,000 each.
Okay. All right. Well, that's the only question I had.
Thank you.
Thank you, Mr. Chair.
Thank you so much. Does anybody else have any other questions or comments? I have a motion by Senator Meredith for approval and a second by Senator Boswell. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
That was pretty painless, wasn't it? Okay. Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith.
Aye.
Chairman Hart.
Yes, motion passes. Thank you, ladies, for being with us. The next item on the pool list is with the Behavioral Health, Developmental, and Intellectual Disabilities, and is item number 2 on the MOA amended yellow list. If representatives are here, please come forward and identify yourself for the record. Could you make sure your mic is on? Should be. Thank you.
Brittany Allen, Division Director for Substance Use Disorder within the Department of Behavioral Health, Developmental, and Intellectual Disabilities.
And Stephanie Craycraft, Deputy Commissioner for the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
All right, could y'all please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
Thank you all so much, and I think Senator Douglas has a question.
I do, Mr. Chairman. again, welcome, ladies, to our committee. Could you explain to me, or at least could you describe to me the telemedicine program that we're talking about here? And second question, if I may, Mr. Chair.
Yes,
just
go
so I
right
can
ahead.
tell. Is there any face-to-face, one-on-one included in this particular contract?
Yes, sir. So the purpose of this contract through our Pathways program at the University of Kentucky is to provide consultation services, which can be in person, and also telemedicine services specifically for pregnant women with substance use disorder in rural areas of Eastern Kentucky. So it increases capacity for those women who live in areas that may have decreased access to medical services or OBGYN services or substance use treatment services in those regions. But there are in-person services that are available. In some cases, we may transport women from those rural areas to receive services in the on-site locations throughout the state as well.
May I ask
Yes,
one more?
go right ahead.
Now, I've heard Representative Hart ask the question of how many touches or how many people would you see in a particular period of time. So in 1 month, I know it varies from time to time, but what would be the average number of people that you might see in a month?
In a month, it is going to vary. I could give you an average. Over a year, it's about 200 women that are served through the program. So probably anywhere from maybe 25 to 30 women in a month, but it is going to vary from month to month.
Mr. Chair, may
Yes,
I
go
ask
right ahead.
one more? I'm a little concerned. We've got 200 that we're seeing in a month.
In a year, sir.
In a year, I'm sorry. Over a 2-year period. So we're looking at 400 approximately
Approximately, yes.
for almost $1.5 million.
Yes, and that's across multiple fund sources. There are several different programs in this contract. So there's the telemedicine portion. There's also study working to expand these services to other sites throughout the state. And there's also a partnership with Chrysalis House to provide medications for pregnant women within this contract as well. So there's several different programs that are funded by those funds.
Is there any way I can get some information on what this program truly does, on those things that are funded through this program?
Certainly, yeah. So we can definitely get you detailed information outside of what's in the contract if you would like additional information. Yes.
I would. I want to make sure that we're being good stewards with the Commonwealth's money. That's
Absolutely.
all. Thank you very much. Thank you, Mr. Chair.
Is there any other Representative Bullock?
Thank you for being here today. My question to you is, in your comments, you're designating Eastern Kentucky, if I'm not mistaken. I guess my question is, I'm more towards Central Kentucky, Western Kentucky. Are you reaching out to that part of the state, or is this? Talk a little bit about that, if you don't care.
Absolutely. That's the focus for this particular contract, but pregnant and parenting women is a priority population for our department in terms of receiving services for substance use disorder. So we have several different programs operating throughout the state to provide services for that particular population: substance use treatment services, substance use counseling, medication access, care coordination, all of which are parts of this contract as well.
Yeah.
And this contract also reaches out to Bowling Green, so it does go as far as Bowling Green.
Thank you, Mr. Chair.
All right. Any other questions or comments? If not, do I have a motion for approval? Oh, go ahead, Senator Thomas.
Thank you. My understanding is that you just do more than talk to women by telemedicine.
Yes.
That in addition to that, you provide medicines for them. I'm reading all the service. You provide materials for them. Certainly there's a cost to your storage costs and all your costs there at the University of Kentucky Research Foundation or at the University of Kentucky Research Foundation. And you've been doing it. You're going to do this over over a 2-year period.
Yes, sir.
And because I do like math, if you said you do between 25 and 30 a month, by my calculations, that's somewhere in the neighborhood. You're treating not 400 women, 200 women a year, but you're treating somewhere between 300 and 350 a year. If your numbers are 25 to 30, so you're treating more women than you said. So I certainly applaud UK for doing this, and I can understand why when you take into account all the costs that you incur in providing this kind of treatment, why it can easily get up in the medical field anyway. Why I can get up to 1.5 million over a 2-year period. That's $750,000 a year. 350 people. So there's special needs here because there's substance use disorders. It makes perfectly good sense to me, unless I'm missing something.
No, you're correct, sir. And Senator Thomas, my math could certainly be off too. So, but I will note, yes, there's services that are provided that are non-billable as well. So there's several staff that are supported, at least in part, by this. If there's non-billable pieces, those folks are supported through this grant as well. But you're right, it's more than just telemedicine. It's referral to other services that are required for these folks: substance use counseling, medication access, prenatal and parenting groups for the mother, also referral and care coordination for the mother and the baby if there's exposure to neonatal abstinence syndrome. So there's a number of different services that are available.
So you need to articulate that to us. You need to articulate that to us. So I'm glad I raised the question. That's the extent of my questions, Mr. Chairman.
All right, thank you, Senator. If no other questions, do I have a motion for approval? Motion by Senator Boswell. Do I have a second? Second by Representative Chester Burton. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith. Chairman Hart.
Yes, motion passes. Thank you all so much for being with us tonight. The final item on the pool list is with the Department for Community-Based Services, and is item number 11 on the MOA amended yellow list. If the representatives are here, please identify yourself for the record and come forward.
I am Vanessa Hunter. I'm an assistant director with the Department for Community-Based Services, the Division of Protection and Permanency.
Hello, I'm Chelsea Harrod, and I'm a branch manager with the Child Protection Branch with the Division of Protection and Permanency.
All right, thank you all so much. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
All right, thank you all so much, and I believe Senator Douglas has a question.
Thank you, Mr. Chairman. And again, thank you, ladies, for joining our committee. I'm reading this from the University of Louisville Research Foundation, and what I read is differential response is an alternative to the traditional investigation in child welfare for accepted reports of abuse, neglect. Could you help me with differential response? Because I know there are others who would like to know what that means.
Yes, no problem. So differential response, and another word, if you're looking at contract language, it could also be referred to as alternative response, is a family-centered pathway that really focuses on family engagement first. The biggest difference, I would say, for the implementation of alternative response or differential response is that a report is called in to our central intake with DCBS. And if a report meets criteria and is considered a low to moderate risk, it could be screened for alternative response criteria. It doesn't mean that it will automatically go down that pathway, but the goal is for those lower to moderate risk reports that could go down the alternative response pathway to have a different type of response for families, very much centered around family engagement and services to be provided to the family. Sort of.
May I ask one more question? It's an alternative to the traditional investigation. Is sort of what I'm hearing. Perhaps I'm not quite getting it. Could you walk me a little bit through the traditional investigation and then the alternative response?
I sure can. So the traditional response pathway, a report is called in to our centralized intake team, and it's screened for a threshold of whether or not that report meets criteria. Once it's determined that the report meets criteria for intervention with DCBS, there's different types of intervention, but if it meets criteria for an investigation, then the next step is that report is then assigned to a local county, a local worker. Normally that is where the county where the child resides. Once that report is assigned to a worker, then that report is investigated. So that worker may go out to the school to make contact with the child. That worker will individually interview all members of the family, complete home visits, reach out for collaterals, additional individuals who may have additional information about the family that can help the worker understand what's occurring. So there's multiple steps that occur through that traditional investigation. The worker then has consultation with their supervisor, and then through that consultation, a finding is determined. That finding is then documented, and then that goes on the child abuse and neglect registry. That's a very short.
And then the alternative?
And so for alternative response, some of the major changes with the implementation of alternative response is we are able, if it is assessed and can go down the pathway of alternative response, the timeframes for initiation look a little bit different. We can initiate within 5 days. The biggest change is that the goal is we reach out to the family and we really plan around a family meeting. So it's much less unknown and unpredictable, so that we can give the family time to process the situation that's occurring, and we answer those questions beforehand. So we explain to them the goal of an alternative response and our goal as the cabinet to really work with the family in determining different services that may be beneficial to the family. So the beginning of the process starts out a little bit different. Kind of the middle part is once we meet with the family, it's really that family meeting that is very different in how the engagement and the interaction with the family is all together in one room around a table. You might have your child and mom and dad sitting around the table and all talking about whether it be good things or bad things, but we're all talking about those things together, and then coming up with a plan of what those services might look like for the family. It's also less about reaching out for that evidence or that finding around concerns. It's more so very centered on the engagement.
Thank you very much. Thank
Yes.
you, Mr. Chair.
Is there any other questions? If not, do I have a motion for approval? I've got a motion by Senator Thomas for approval. Do I have a second? Second by Representative Chester Burton. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith. Chairman Hart.
Yes, motion carries. Thank you, ladies, for being with us this
Thank
evening.
you.
Please take a moment to review items 12 through 15 on your agenda. And after reviewing, do I have a motion for approval? Motion by Senator Meredith to approve. Second by Representative Pollock. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock.
Yes.
Senator Meredith. Chairman Hart.
Yes, motion carries. Senator Boswell, go right ahead.
Yes, thank you, Mr. Chairman. I just have one short comment. I did not pull this contract, but I did just want to call attention to it. On the memorandum of agreement Transportation Office Secretary number 130 mentions a contract of a monthly of $1.75 million, and it mentions on here litter removal. I just want to call attention to this contract, how it's such a very big problem we have in the state of Kentucky right now with litter, and I've got a bill coming. That's this one right here, $1,750,000, and there's another one also that mentions litter. We are picking litter up all over the state, and it's cost us millions of dollars, and we need to do something about it. That's it.
Just before we adjourn, just to remind you, the April meeting will be on April the 9th, 2024 at 9 a.m. This is during the veto days, and that's why we have the early time frame. So, all right. If there's nothing else, we stand adjourned.